Hello, this is Dr. Gay from First Like MRI. This is a 66-year-old female with right shoulder pain, and we see this obvious finding here. This is in the spinoglenoid notch. We see a fluid collection that is expanding the notch. Here's another view of it. This is a coronal T1 weighted sequence. You see the sharply defined corticated margins. There's a funny fluid signal intensity structure. Within here you can see the neurovascular structures. Now in this patient they did have some edema. I'll put up this view here within the supraspinatus and infraspinatus muscles, also maybe the teres minor muscle, but we have edema here and here. When you see that, first thing to think of is suprascapular nerve compression, and look at the spinoglenoid notch, which we do, and say, whoa, here we go, we have this big fluid collection. So the first things to think about are, number one, a ganglion cyst in the spinoglenoid notch, and number two, and a paralabral cyst that's coming off the back of the posterior superior labrum, and they go into there. Sometimes you can have a labral tear that's just scarred down and it's not even visible, and you can still have this communication. So this could be a big spinoglenoid notch ganglion cyst, or this a paralabral cyst that's going back into here. Now there's a third thing that's much more rare, and this may be what this is as well. This is a vein back here. You can see it going horizontally across, splitting. And on this view, we see that it looks like it goes right into this. So this may be a venous varix. And this is just looks like unilocular. It's not multiseptated. Most often the ganglion cysts or the spinal or the paralabral cysts often will be more septated. This is just one collection, and since it does look like it communicates in that one view there, a varix is also possible. It would be a long-standing thing. You can see how well it's eroded, and this does look pretty unusual too. You see these not terribly infrequently, and this definitely has a more peculiar look, this sharply defined margin. So again, this may be a varix since we saw the communication, and then this very curious look. But I would put all the things in there just to cover the basis, and just an interesting case of suprascapular nerve compression and the enlargement of the spinoglenoid notch.